Okay. Hmm. Hello. Hi, everybody. How are you guys doing? It is about 8:25 here. So people are coming in. I'm going to let people jump in. We're also streaming live on YouTube. Our first time jumping in. When you do come in, you will be automatically muted because this is expected to be a pretty large group. So be patient with me. So people are jumping in now. But in the chat box, if you can go ahead and please just let us know where you're from. It's always nice to know who we have here. I know we have a lot of people here from our Facebook group, but if you are from somewhere, just let us know in the chat box. Again, as you come into the webinar, you will be automatically muted so that because we have such an anticipated large group, we can limit a lot of that background. The session is going to be recorded. So if you don't catch the whole thing, you can definitely catch the replay in the group. Or you can also catch it on YouTube. It's supposed to be streaming on YouTube as well. So awesome. So I hope everybody is doing well. So it's about 8:25. I encourage everybody to get in early, but we will get started about 8:35. So just be patient. Let us know where you're from in the chat. We are moving and shaking today. And thank you guys for hanging out with me tonight. I'm kind of excited about this session tonight. So if you want to take your phones off of video, you can. What you should be seeing right now is just the actual presentation. Hi, Antrina. Hi, Derica.
Hello, everyone.
Hi, Carla, Craig, Crystal, Mona, Sharita. We have quite a few people here. Shakira, Winter. So as you come into the webinar, it will place you on mute. So feel free to jump in the chat and let us know where you're from. And we'll get started here in a couple more minutes. I hope everybody is doing well. Crystal, you're from Augusta, Georgia? Small world. I have a grandmother down there. Hi, Siona, James, Tanya. Okay. All right, Brittany. Again, I'm giving everybody a chance to jump in. And we'll be getting started here shortly. And as I mentioned earlier, this will be saved onto the group, as well as we're also streaming live on YouTube. So if you guys, actually, Siona, can you check and see if it's up on YouTube? You know, I got a one-woman show going here, so I know that you found me on YouTube, so you follow me on YouTube. All righty. And if you haven't, go ahead and mute your mic so that we don't get any feedback. And because I love to be prompt, we're going to start at 8:30. So if you want to catch the replay, you can. It'll be on YouTube. It'll be saved into the group probably on Friday. Feel free to introduce yourself in the chat and let us know where you're from. So I'm super excited about this webinar. I think for some people it's well overdue. So I'm excited about, you know, what I have to talk about tonight. And we'll definitely have some time at the end of the session to allow you all to ask questions. All right, let's see who we got here in the chat. Jerry from Louisiana. We got some North Carolina, Los Angeles. Let's see. Okay, so since we're going to get started, I'm going to go ahead and record. I'm going to let a few more people in. As well. And while we wait for just a few more people to jump in and we hit that 8:30 mark, I'm going to go ahead and see who else we got here in the chat. Okay, thank you, Siona. Okay, so we are on YouTube as well. That's exciting. You guys have no idea how challenging it can be to finagle all of this at the same time. But good to know. Okay, we got Michelle from Lancaster, Brittany from Ohio, Latasha from Mississippi, LaShonda from Louisiana, Shushma from North Carolina, Mona from Los Angeles, Winter from VA. Where are you in VA, Winter? I spent quite a bit of time there. Miss Shane from New York, Chisha, I might be saying it wrong, from Mississippi, Shakira from Ohio, and Trina from Virginia, Carla from Florida, Dominique in Mississippi, Crystal in Augusta, Georgia, Letitia, okay, Lakeith, is that how you say that, from PA, and then Derica in Texas. Okay, looks like we have a whole bunch of people throughout the United States, so that's awesome. I'm excited. All right, so it's 8:31, everybody. Okay, we got a few more people jumping in. And Shanika from Atlanta, Shanika Jones, which is really cool. So I'm gonna mute everybody. Like I said, if you wanna catch the replay, go ahead and catch it on YouTube. I will download it into the group, but you guys gotta give me a couple days. So I'm gonna promise it on Friday, and that's probably the best I can do. All right, we got a few more. Okay. All right, so let's go ahead and get started, guys. All right, so for some of you guys, you may have already met me before, but I'm gonna go ahead and introduce myself again. My name is Shamika, and I am actually the creator of the NOSA group, where most of you guys have seen this information. So tonight, specifically, we're going to be talking about a course that I'm offering on August 16th, the Ultimate Staffing Agency. So this is what this webinar is about. We're going to talk a little bit about the course, what's going to be inside of it, what you can take away from it, and answer any questions that you guys might have about it. So like I said, if you can keep yourselves on mute to the end, there will be a spot where you can ask questions, as well as if you want to ask a question and you may have to jump off, you can always drop it in the chat box and I'll catch you, okay? All right, so the Ultimate Staffing Agency webinar is the ability to create your own healthcare staffing agency without a large budget or even any major overhead costs. So let me introduce myself again. So a little bit more about me is I'm a human resources expert. So for the last 10 years prior to becoming a nurse, because I'm a second career nurse, I worked in human resources, as well as while I was involved in my nursing career, I was a travel nurse. So I traveled, I worked as a staff nurse, I worked on med-surg floors, I've done long-term care, I've also done hospice care. And one of the things that I really looked forward to in transitioning from human resources into nursing was the travel piece. So I was the travel bug. I traveled to Vermont and Massachusetts. I've gone to New Mexico, California, Colorado, as well as Hawaii. So what I've been doing with myself lately is I've dedicated myself more so to NOSA, to being a nurse-owned staffing agency owner and an all-around staffing expert and consultant. So that's what I've been spending most of my time in the last few years focusing on. Now, don't get me wrong, if the right opportunity presents itself, because there's been a few during COVID, I'll definitely put my nurse hat back on and get out there and work just a little bit, but it definitely has to be the right opportunity that fits me. For some of you guys who aren't a part of the NOSA Facebook group, I'm also the founder of the NOSA Facebook group, which is a community of over 5,000 on Instagram and Facebook of healthcare professionals who want to understand and grow and learn and network and collaborate and explore healthcare staffing as a business opportunity in a safe space. And that's what I offer. So for all of you guys who are in the group, you know what it is. It's a lot of opportunities to ask questions, get information, connect, collaborate, network. I know a lot of you guys have already connected with each other offline. I got the opportunity pre-COVID to really be able to meet up with a lot of NOSAs. I met up with some NOSAs in California, Ohio, Florida, and most recently in Virginia. So some other things that I've been doing specifically since creating the NOSA group is I've been featured in Allure magazine, Entreprenista League, and I also did Katie Harris's Nursepreneurs podcast. So I don't want to spend this whole time talking about me. I want to make sure that you guys get the information that you came here to get. So we're going to move on. So some of the back information about how my journey got started, if you haven't seen it, the podcast with Katie Harris is in the group, but I'm going to kind of give you guys a quick synopsis. So I traveled for about 4 years. And on one of my travel assignments, I connected with a fellow traveler, as we always do. And we clicked and decided to travel to another opportunity in New Mexico. And from that experience was kind of where the conversation began with regards to the idea of starting a healthcare staffing agency. So initially I was hesitant because with any business, there's always the, I don't know, is it going to work? Is it going to make sense? And from there, we went on to kind of do the paperwork, the initial process that I'm sure some of you guys are in, and we end up starting right where we were, which was New Mexico, which is essentially where we touch on some of the 4 pillars that we'll talk about, which is about your underserved niche. So our niche was long-term care, and the underserved area was actually in New Mexico. So New Mexico is about the size of Georgia. It's not as heavily populated, but they have needs all of the time. So they don't have a heavy population of educated healthcare professionals. So the need for nurses was always there. The opportunities for overtime was always there. So after about a year of working as travelers, we kind of transitioned into the role of healthcare professionals. So persistence in relationships is key as well. We didn't do what you guys are doing. So I definitely applaud you guys for taking out the time to find someone who can help you create a real doable roadmap. The two of us, for whatever reason, jumped in. So we jumped into the idea of being a part of it and just kind of went with it. We didn't know which way was up, which way was down. So because of that experience, we had a lot of mistakes along the way, i.e. the reason that I created the group. So our mistakes along our journey was part of the reason that the group came about through frustration, and that we wanted to see, is there a place or a group of people that's out there doing it like us, who can provide some insight, who can provide some information. So essentially, we did that over time through one of our relationships at one of the facilities. We were able to obtain our first contract. And then from there, through marketing, we obtained our second contract. So for us, we decided, because we were both nurses, to self-fund. So our monies went back into our agency, and we also worked the agency. So that model can look different for different people, but that was a model that we decided to go with under the circumstances. And you kind of have to determine what works for you. My model is, you're a nurse, you can work, go to work. Why not? But other people have different approaches. So you just kind of have to work it based on your particular situation. So as we already know, if you didn't know, in the United States, the nurse turnover rate is probably even higher than what we see here quoted in 2015 at 8.8%, with a yearly high of 37% yearly. Nurse turnover is a big deal. It's a bigger deal now more than it's ever been, mostly because nurses are tired. Who knew COVID would be around? Who knew it would be around for not only a year, but as we enter in our second year with COVID and the crises and the hospitals and the long hours and the crisis pay and all of the things that come with it. You know, at the point that we really thought we were downturning, it has really created a uptick where, one, we have a population of nurses who the average age of a nurse is 51. So those people are eligible for retirement, who probably will leave the industry, but we also have quite an influx of nurses entering the industry at a place where it's under a lot of duress. So being that our country is 4 million nurses strong, we're more than enough. Nurses have more than enough options when it comes to work. So we really have to think about, as we enter in, or even if you're just exploring the idea of starting a healthcare staffing agency, what makes you different? So staffing is never going to go away. What we're experiencing now with the staffing surge or issues or challenges with staffing is something that they also experienced in the 90s. So the demand for nurses is increasing. And unfortunately, because there sometimes aren't enough nurses, some healthcare facilities will look to agencies to meet those needs for filling any gaps in their hospital or nurse care. So essentially, the goal for tonight is to allow you guys to better understand how to start a healthcare staffing agency the right way and move yourself in the right direction to be able to launch it and be successful at it. So what we're going to talk about tonight is really just an overview. We won't go into all the details, but we'll definitely touch on what the course will offer. One of the key principles is making sure that you understand what the problem is. So we work in health, or we know staffing is always a never-ending problem. It's one of those things that is never resolved. And even when it is resolved, if new management comes or something changes, it kind of comes again. The next thing is figuring out what area you want to work in. So I always encourage people to think about that early on in the stages in the process versus once you launch, because you want to make sure that there's a need there. You know, you want to make sure that there's not already an existing agency doing exactly what you're doing. And we'll talk more about that when we go into your niche. And then thirdly, you want to make sure that you're actually creating a solution to the problem. So healthcare staffing agencies are a little bit bigger than just the idea of filling a body. You want to create a community of people that want to work for your agency. So in doing that, creating a brand around your agency, making sure that your agency is visible in different platforms is all important about creating a solution for your facilities to access your staff easily and your staff to access opportunities easily as well. And then step 4, of course, is to take the first steps to build a profitable agency. So a lot of people get into this business sometimes for the wrong reasons and or struggle because they started the process the wrong way, or they started the process the wrong way. So getting in, part of starting any business, the goal is to be profitable. So for some people that may look like, maintaining a legacy for your family. It could be like replacing your income at your job. It could be retiring from your job, or it could be a second income stream. So whatever that is for you, you want to make sure that you're positioning yourself to make sure that your agency is always being profitable. Okay. So there's so much to know. No one really gives out the secrets to starting a staffing agency. Everyone is on their own to figure it out all the time. And this is true. And you guys give me a thumbs up in the chat box if that's been your experience. In our experience 3 years ago, the information was so limited and so closed off that we definitely had to go through a lot of hoops to figure it out. I feel like now, if you're starting your agency now versus maybe 2 years ago, there's a lot more access to information through Teachable or Facebook or YouTube or other platforms where people are sharing the information. But early on, it was like a closed door behind a closed door behind a closed door. And when you ask questions, you would get quick one-word answers. No, we don't accept agencies. But okay, thanks, guy. Or we use a different system. We get short one-word answers, and then that would be kind of the end of the conversation because you would definitely have to go back to the plain board. So yes, I see you guys are saying yes. It's a lot better now, to be honest. And even recreating and revamping this course, I've even been able to find way more information about that process than was available 3 years ago. So here are some of the people that work with me. These are some of the people, kind of your day ones, your early on people who were a part of the NOSA group when it very initially very first started. And both of these individuals were nurse entrepreneurs and or NOSAs, and definitely got the understanding of what it means to give back to our community. So part of the reason that I call the group the Nurse-Owned Staffing Agency or the NOSA group is because I want to empower nurses. I want to empower nurses so that they know you do have an opportunity to own a business if that's something that you desire. There are avenues and opportunities to create second, third, fourth streams of income, and you can do it efficiently and profitably. It's not something where you have to have hundreds of thousands of dollars to do it, but it's also something that you want to do strategically so that once you reach a certain point, you don't have to start over again because you missed a step. So now I want to show you some of the essential skill sets. So some of these are things we've always talked about, but mostly so that you know what to have in place when you get started and you know what you need to continue to have in place to scale your staffing agency. So here are my 3 secrets to getting started. One is create and pick your niche and make sure it's clear and understood. Number 2, build relationships. I am all about building relationships, if you guys haven't noticed. Build relationships not only with nurses, you want to build relationships with businesses in your community, fellow agency owners, vendors, and potential employees. That you want to make sure is an ongoing thing that you're doing. You don't want to, once you launch or once you have 4 or 5 contracts, to reach the point and say, oh, okay, I'm not going to foster and continue to manage these relationships. You'll end up in a bad place if you do that. And then thirdly, create your marketing strategy to connect with nurses and hiring facilities. Marketing, marketing, marketing. The big part of this process of getting started that a lot of people have found to be a hurdle is the marketing piece. And what I realized in just kind of looking back at my own experiences and hearing the experiences of others is that marketing is a skill that is taught, but is not a skill that is taught in nursing school. So for many of us, the two of us included, me and my partner, some of us have strong clinical skill sets, and then some of us have strong like administrative business operation skill sets. So if you're one of those people, which I totally understand, honing in on this marketing piece will help you kind of elevate yourself to the next level. So let's talk about picking a niche. Finding a niche is key. And when you're finding one, you really want to think about where are your underserved areas or locations. So sometimes it can be a combination of both. So for instance, with us, we picked a niche of a underserved area, which was the Southwest, specifically New Mexico, and an underserved specialty, which was long-term care. So in that particular location, the need for long-term care was huge. So it's not the case in every state, but sometimes you can niche out from a state level, and then sometimes you can niche out or a regional level or from a specialty level. So it just depends. And I'll give some examples shortly. And it really allowed us to get our foot in the door. So Yvette Thompson, one of the NOSAs with DNP staffing, was saying she wanted to become a nurse. She interacted with nurses, she traveled, and she saw how much they loved it. She decided to become a traveler, much like our journey, and was working for companies, as many of us do. And she said to herself, which is exactly what I said to myself, is, hey, this is something I can do too. I can do this too. And honestly, it is something that you could do too. As nurses and healthcare professionals, we inherently have in place a lot of entrepreneurial skills. So we multitask, we deal with difficult people, we have to have administrative and clinical skills. We're able to do presentations and introduce ourselves to people who are new or new situations. We have to be adaptable. And the list goes on and on and on. We work long hours. That's definitely one of the things. So it's just kind of perfecting those things as well as identifying those things that sometimes you have to work on. The next one is there are a lot of agencies out there. So this conversation and this topic comes up a lot, and it comes up a lot based on perception, right? So are there a lot of agencies out there? Yes. In COVID alone, we saw all types of agencies that we had never heard about come out of nowhere. And one, that should kind of tell you, hey, there's options for opportunities. But for some, it may say, oh, the market is oversaturated. In the group, maybe a couple of weeks back, that was a question that one of the members had posed, which I said was a great question. And some of the NOSAs responded, which I totally agree with, is, hey, so if you're in the grocery store and you see a couple of different bread options, do you think in those instances that it's oversaturated? Or do you think that you're being given options? So, of course, you guys know that my answer is whether I shop at Publix or Giant, Safeway, or Kroger's, Aldi's, or Trader Joe's, they're all grocery stores. And in some locations, they're right next to each other. So does that mean that I couldn't open up my grocery store? Maybe. Or does it mean that I have to open up something a little bit different? So essentially, that's why picking out your niche is important. And here are some of the types of niches people have done in the past. Some people have done neurosurgery. We have a team in NOSA now that specifically work around the cardiac first assist element of healthcare, long-term care, of course. We also had an amazing NOSA that was labor and delivery out in the Southwest. Dialysis, we have a dialysis NOSA in the Midwest. We have outpatient facilities, stroke, rehab, pediatrics, ICU, tele, med surg, those are all niches. And it's not to say that you can't work in the other areas, for instance, like a long-term or LTAC hospital. It's just to say that needs to be, your niche needs to be the thing that makes you different. So it's the thing that you want to make sure that you're highlighting in addition to the other things that you offer. So how specialization works. So in addition to having a niche, you also want to make sure that you're offering a unique skill set. Something that's precise and something that'll set you apart. And a good example of this would be if you were an ICU nurse offering ICU nurses, which would be an awesome thing to see, to healthcare staffing, healthcare systems in the United States or in the Southwest or in the Northeast or in the Midwest. That's a niche that's specialized because not only can you offer a facility the staff, you can also offer a level of expertise that sets you apart from a generic healthcare staffing agency. If I'm an ICU nurse, which I'm not, but if I am, I know what a good ICU nurse would look like on paper. I know the skill sets that they should have, the background, the types of care, any sort of competency testing that they would need to complete. And that would look very different than if a traditional staffing agency just put a post out, somebody applied, they had a conversation, maybe talk with the manager, and that's how they made the selection. So if I'm a facility, I'm picking the nurse or NOSA or the agency who, if I'm looking for ICU nurses, who is an ICU nurse themselves. And then the last thing kind of around your niche is one of the biggest secrets in the industry is if you're not in a location that is underserved, is to specialize in recruiting specific nurses with a skill set. You want to look into doing that. Like that's the one thing that'll really become your selling point, is that if you offer something that a larger or mid-size or even a local agency doesn't offer, which is, hey, I'm a long-term care nurse. I've been doing it for 10 years. I know what a good long-term care nurse looks like. I know the skills, I know the high ratios, being able to deal with conflict, multitasking, all those things that you need to be successful in those types of environments. All right. And then secret number 2 is relationships. So the first one we talked about was the niche. Now we're going to go into relationships. And both of these things are tangible things that don't cost you money. So to create a niche, that doesn't cost you any money, doesn't cost you a little bit of time. Fostering relationships, same thing. So you don't need to have a large budget to start a staffing agency, and you don't need to you don't necessarily need to staff the cases yourself. So like I mentioned, sometimes people have options, which is really nice about our industry. You can work the shifts yourself, or you can get somebody else to work them. But one of the things that's important in doing so is making sure that you have good relationships and systems in place to foster those things. Your business really is, and this is such a great secret number 2, is it's as good as the people who know you. So creating your relationships with hospitals, vendors, nurses, and agencies matters. Having those conversations matters. Being consistent, checking on people, reaching out randomly, wishing them a happy holidays matters. And one of the reasons that it's important is because it really allows you to be able to, at a later date, benefit from that relationship. So what I tell people is not all the conversations that I have with regards to business or even opportunities am I looking to get a win in that moment. Sometimes you want to get to know the person, you want to get to know what it is that they do, as well as what it is that they're looking to do. And then at a later date is when you're able to, exchange a business opportunity or present a business opportunity to them. But if you don't have the relationship, that kind of really closes the door for your ability to have the conversation. For example, we had a NOSA grad recently reach out to me from the Midwest. And she said to me, hey, Shamika, one of the facilities I'm working at now is looking for some dialysis nurses. And I was going to share it with the group, but I wanted to talk with you first about it to see if you knew anybody who you thought might be a good fit. So, of course, I was excited that she shared the opportunity with me. And then, of course, I immediately directed her to NOSA in Ohio, who's actually here on the webinar, who could assist her, because that's about fostering the relationship. So, of course, that NOSA graduate had taken the course in 2020. She went on to open her agency and then kind of shifted a little bit, but she was more than willing, even though her agency wasn't actively up and running, to share opportunities with fellow NOSAs because she believed in what it is that we're trying to do. And that's about creating and fostering the relationships. Same thing with nurses. When we first got started and we had a flu contract for staffing throughout the United States, and we were looking for flu nurses and per diem flu nurses in Georgia, I looked at my Rolodex and I called my friends, and I called friends who were friends of mine for years. We had worked together on assignments maybe 3 or 4 years prior. Hey, we need to fill this job. Do you think you can help us? And for a lot of times, if they could, they would, but if they couldn't, they were always willing to pass it on to the next person. And then, of course, with a vendor, same thing, that relationship. One of our second clients was a large vendor who does per diem flu vaccinations throughout the United States. I reached out and essentially sold our agency. I said, hey, we do this, we do that. One of the benefits was they had worked with them. I had worked with them for years, maybe 4 or 5 years. During flu season, they had an extreme need and had very difficult time staffing in New Mexico. They were more than willing to say, okay, send us over the contract, Shamika. We want to work with you guys to help us staff our flu clinics in New Mexico. The relationship. So, as good as the who knows you is so key. And there's so many other stories I can tell. And I'm sure you guys have some to share as well. And one of the things that makes, and I just kind of gave the example about the fostering of the relationship, is the fact that it can lead to contracts. Another example or situation that happened with us, and this was early on, this was probably during our first 6 months, was we have a LinkedIn page. So if you don't have a LinkedIn page, yes, guys, I'm going to tell you, you need to get a LinkedIn page. We had our page set up. It looked nice. And we also added, because both of us did it, HEDIS chart review nursing as one of the types of staffing that we offer. We had a company, Blue Cross Blue Shield of New Mexico, reach out to us and want to work with us to provide staffing services specifically in New Mexico, just from the LinkedIn page. We hadn't known the people, we hadn't had any interaction, just from the LinkedIn page. Those small things, the fostering of those relationships really does help you get to the next step. So, of course, secret number 2 is about getting the contract. Getting the contract with the agency is not that difficult. It is really about who you know. And for some of you guys who are in that process, you can definitely vouch for that. Sometimes people's opportunities when it comes to contracts happens instantly. And many times it may take months. What I tell people when you're getting into that space is to really think about people who you can reach out to first. You want to think about the people who, you've worked with, friends or friends of friends who maybe have taken DON positions or things of that nature. Those are great places to start. I want to say, Lydia, our LinkedIn page is business. I'm pretty sure it's business. Those are great places to start, because then you kind of create a familiarity with that person in a way that a cold call can't. Now, don't get me wrong. You definitely need to be doing a cold calling too. But yes. Those relationships could eventually lead to great contract opportunities. And then to give you an example, Verania out of California, she kind of did the first 2 steps, which are so key. And sometimes we don't spend enough time with. She made her niche behavioral health. She's a psych nurse, of course. Is there a need for psych nurses? Probably now more than ever with the whole COVID-19. and all the after effects that we'll eventually experience from it. But she also added addiction and detention center placement as well as one of her niches. And she really has perfected the art of networking. Everywhere we go, anytime that we're doing something together, she's gone to TravCon. She's also done a couple of crisis contracts. She has created for herself a network of nurses, a network of opportunities, so that when opportunities present and she needs a team of people to come together, or she wants to reach out to people for opportunities, she has established a true Rolodex so that those things can happen for her in, you know, in the behavioral health, addiction, and detention center space. So how do you build those relationships? I totally agree in saying that you want to spend time with it. So I always say 110 times, you guys have heard me say, hey, reach out to your fellow NOSA in your area. You know, you should talk and connect with them. You want to reach out to your fellow SCORE and your small business development center and anything related around the things that you're doing or trying to do. Those are those people that you really want to foster those relationships with. And doing that prior to launching really allows you to build a little bit faster, as well as get the key people in place. And we'll talk a little bit more about who and what those key people can be. And then finally, my favorite topic on Secret 3 is your marketing plan. Marketing is key. And for those of you who are struggling in marketing, you will understand why. Marketing is everything. In healthcare in general, it's a relational business. And even in healthcare staffing, it's a relationship business. When I found out about maybe my second or third travel opportunity, and really my first travel opportunity, it was from a fellow nurse. So it's something where it's not so heavily based on all of your skills or abilities versus the relationships that you have. So when you create your marketing plan, you want to create it something unique. You don't want to wing it. You really want to put time into it because you want it to actually generate the benefit. So one of the benefits of the marketing plan is to pipeline potential clients, but you also want to pipeline potential staff, as well as build your brand so that if you see or if you hear about the NOSA group or any of the agency owners here in the webinar tonight, you can put a name with a face, a vision, a message, background information, all of that. No different than when you hear Tide, you think of laundry detergent. So what are some ways to market? So the ones with the asterisks on there, the top 3 are my favorites, which is personal contact. So personal contact is important, but of course we won't be doing too much of those. But you can do things like what we're doing here, a Zoom call, a Google Meet, FaceTime. There's so many platforms that you can virtually meet with each other so that people can put a name with a face. Having a phone call is great, but seeing the person really makes a true impact. The second one, internet presence. Yes. Please get yourself on the internet all over the place. And when I think about internet presence, I'm really touching on social media. I'm on social media all day, every day. You guys see me. I'm getting better with Instagram. I'm in love with Facebook. I struggle with Twitter. I really, really like TikTok these days. And that's how people find me on all those platforms, LinkedIn, TikTok, YouTube, Facebook, Instagram. At least 5 to 10 people have found me on those platforms and reached out. The other thing is, of course, your collateral. And that's like your business cards or your brochures or your flyers or things like that. Those are important too, because if you're going into any facilities, like if you're somewhere where you can go into a facility, you can always provide that as a reference. So you can talk a little bit about your agency and what you do. And then, of course, the last 4, direct mail, market education, advertising, and public relations are good. And there's definitely something you can do, but I would really put more of my focus on the top 3. So on to a little bit more about marketing, your Dream 50. So Dream 50 is a concept, but to make it applicable and make sense to what we're doing here, your Dream 50 really talks about focusing in on 50 opportunities or clients to market to. So you want to make a list of 50 facilities that you will concentrate on and focus all of your efforts there. So the whole concept of you get what you put your time into, or the things that you focus on become your realities is really based on what the Dream 50 is about. What that looks like from a healthcare staffing perspective would look something like, I would go out to Medicare.gov, which I always talk about, and I'm going to drop the link here for you guys, and look up your particular specialty, because just about all of the places use Medicare.gov, and then, create a geographical area. I say based on your zip code, but I'm going to put it on here one more time. But you can pick, what you want to do. And then that becomes the first part of your Dream 50. And from there, you do your initial cold calls and you reach out to facilities. And then the facilities that you get the best response from, meaning you get an answer, you don't get a no, you get a maybe you sent a contract, or you were able to get in touch with people, then you want to create a shorter list, which is essentially your Dream 50, and where you want to put more of your focus. And then those 50 are where you want to continually reach out to and work towards getting to a decision maker. And sometimes that looks like Google searches, or it may even look like Facebook searches or LinkedIn. So a little bit about the social media piece is that a lot of people on social media your decision makers are on LinkedIn, your employees are on Instagram and Facebook, and your decision makers are on Twitter. And then TikTok is really a hodgepodge. And I will say this for you guys, which I'm super excited about, is TikTok is starting to recruit. So TikTok has a recruitment element to what they're doing as of recent. So if you're not on there, I would definitely consider it, especially if you're looking to recruit for people. And then, of course, you don't want to chase everyone. So once you're able to get to your 50, you want to definitely kind of trickle them down to a few, which is 50. And then, like I said, begin to identify the key people who make a difference in your business, so you'll save time, money, and effort. So you want to identify the key people who are decision makers, who can sign contracts, make decisions, or connect you with decision makers, or if they're part of a vendor management system, that as well. So marketing is a must. As you guys always hear me say, it's a skill. So it's not something that you come with automatically. It's not something that is an easy learning curve. I always tell people, hey, if you're struggling, talk to somebody, get a coach, a mentor, or attend YouTube University. And another great mentor opportunity is through your local SCORE, and that's SCORE. They have a lot of great resources around helping business owners, especially small business owners, develop those types of skill sets. So check them out. Every state has one, guys. So check them out as well. And you don't want to kind of wing it. So in order to be successful, you really, really need to hone in on the skills that you struggle in. So I've said a lot. I want to give you guys the opportunity to ask questions. I don't want us to hit too far into our time. So I'm going to go ahead and talk with you guys a little bit about the program that I'm offering. And then at the end, you guys will be able to ask your questions and take yourselves off mute. Okay. So 5 minutes, I'm going to talk about our program. And then you guys, if you can't stay, because we should hit about 9:50, 10 o'clock, go ahead and drop your question in the chat box, and I'll read it off once everyone else has had their chance to ask their questions. So, all right. So what I'd like to share. So for those of you guys who don't know, this is actually the second course. So there was an original course that I offered in around this time 2020. So what I'm offering this time around is a revamped, a remix, a more appropriate version of the Ultimate Staffing Agency Mastermind, so that the things that I learned from the first course, I was able to tweak, I was able to add, connect, and partner with people to fill in some of those gaps, so that when you guys get out there, I've heard so many stories. I want you guys to win. I want you guys to feel not only, hey, I'm doing this thing, it's really, really great and awesome, and I'm excited about it, but I'm winning at it. I know what I'm doing. I'm confident about the things that I'm doing, and I'm confident about knowing what I know. So what makes this particular product that I'm offering unlike other products? So one of the key things that I think helped our agency be established and grow is that you have to set up the business side of your agency in addition to the clinical side. And they're a little bit different. So for me, the business side is the operations, the accounting, the administrative, the credentialing system, human resources, employee manuals, policies and procedures, workflows. You guys hear me say that a lot. Workflows and processes. That's the business side. More of the clinical side, in my opinion, is, the day-to-day staffing and scheduling, identifying the needs of particular clients and shifts, managing, that quality management piece with facilities and kind of partnering along with the facility. So it's more of the facility side of the industry. But ultimately, in order for you to be successful, you really need both. So we also we help you with setting up the business, and we help you with setting up the marketing, which is really the area that people from my experiences have struggled the most in. So this is a little information about one of the people that I've worked with, and we're also partnering with her and her experience, and just about how to get the information you need and really how key it is to have it. So this is what we're offering, guys. We're offering an 8-module course that will walk you step by step through the process of starting a staffing agency in a tightly knit group. So you'll get the information, the tools, the resources, the access to and about the industry to effectively compete with larger agencies, as well as to perfect your own niche where you're located. Of course, you'll have live coaching calls with me, as well as access, which I think most of you guys already have, access to the private Facebook group. And at the end, I will share the Facebook group for those of you guys who aren't a part of it. You'll also get access to contract templates, your policies and procedures, your new hire manuals and orientations, and also your pay package calculator. So many people don't know how to write a contract. That's a question that comes up in the group a lot. How do you write your contract to the facility? How do you write your agreement or your contract with your employee? That's important because contracts are at the state level, but you want to make sure your contract is right. And you also want to make sure that your contract actually covers the things that you needed to cover. And then all the other forms. So all the other forms that you would need to take a applicant from A to Z, as well as take your agency from A to Z. And the pay package calculator is a big thing. It's something that we've worked on over the last 6 months because it matters. Making sure you're hitting that right bill rate to make sure that your agency stays profitable is important. That's what you guys got into the industry for. You also want to take into account with the pay package calculator, when you're putting in bill rates, you already want to have an idea of, hey, the agency is going to take home this amount or this percentage. And by doing so, as your agency ages, it really allows you to do what is referred to as forecasting. So in my opinion, in order to really grow effectively, you need to forecast. So in order to forecast, you want to know, hey, I have 20 nurses. We're billing at this rate. They're in these long contracts. I anticipate these many nurses in Q4 of 2021 or Q1 of 2022. At this point, our agency is ready to grow because we're hitting our goals and we're hitting our anticipated growth level. So, as well as you guys already know, the vendor management system. And for those of you guys who might not be familiar with it, essentially a vendor management system is a third-party system. So it is where healthcare systems, large hospital systems, many are a part of, go to a company and say, hey, we want to put all of our jobs in this computer system. Can you do that for us? And we want you to manage it, organize it, as well as find agencies to staff these particular needs. So that's kind of where the third party comes in. So it's the healthcare system, it's the company that manages the system, and then it's the agency owner, you guys, myself, who actually get access to that system to fill their needs. So the talk about vendor management system is always happening, but honestly, it's not going anywhere. VMSs have been around for years. It's in every industry. Government has been using it for years. A lot of IT companies use it. So it's not something that's going to disappear. And I anticipate as we kind of shift through COVID, it probably will upswing. So we'll talk about that, the process, what it looks like in your particular state, how to access them, how to determine which ones you're eligible for, because different VMSs have different requirements, and training. So the VMS is a computer system. So it's something that you want to get trained on. You want to kind of plan and prepare for. So one of the things that I do, and I will say that I do like about the VMS, because we're a part of a VMS, is the fact that you get high volume. So being in the VMS, you do have to pay a fee to access it, but you also have high volume. So let me ask you guys this. How many jobs do you think is currently in the career staff VMS? Just give me a good guess, guys. Just drop a number in the chat box. Like, in the career staff VMS, how many jobs do you think is in there today? And just guess. Mimi says 1 million. That's a good number, Mimi. 10,000. We got Dell 3 to 500. Global Nurse Connect says 10,000. Michelle says 2,500. Erica says 500. 1,000. Shakira. Crystal says 8,000. Okay. So in the career staff, 300,000. Sarita. So in the career staff, so there's multiple different types of VMSs or MSPs, but just in the career staff VMS today, it is 10,000 jobs. So when we talk about volume versus time versus money, I am okay in my business model with having more volume, which is what nurses need because they want to continue to work, than what might be offered in some of your direct clients. So I tell people VMS is just an option, but you always want to diversify your portfolio. So for us, when we did our portfolio, we had a VMS, which was our primary client. And in the VMS, you have multiple clients. We also did flu clinics. And then we also did some permanent placement. So that was our model. And then as far as like staff types, we did per diem and contract. So you kind of have to figure out what works for you, but it's not going anywhere and it'll be around. So this is Kajaz experience with the VMS. She started, this was maybe a year, probably like 2 years ago when she started. She started in 30 days. We worked together to get her signed up and moving. And she was able to staff and get going in less than 30 days. So the process can be challenging, but it's totally doable. And sometimes the challenge is the computer piece. So you just kind of have to prepare and work with systems. Let's see. Erica, I'm going to answer the question, but if you guys can drop the questions, I'll answer them at the end. I got a contract for a flu clinic through Occuvax. So that was a company that I worked with that gave us a contract. So they have a bigger contract and we essentially subcontracted with them. The next thing that we're going to have in this course is credential management. So how many people have realized that the process of hiring somebody takes up too much time? Anybody? Just raise your hand. Anybody? How many nurses on here have gone through the process of getting hired and feels like it takes up too much time? It should be something you could do in like 5 minutes. All right, Alicia, Carla, yes. So one of the things we offer, and you guys probably already know the person we're partnering with, is access to a credentialing management system. There's a lot of systems out there, but we found this one to be the most friendliest and nurse-centric system. And it helps you with the recruitment process. It helps you with the hiring process so that they can get all their information in one system and you can access it too in one system. So you're not going through multiple places and looking and, oh, well, can you send this here? We forgot this. Now we have to submit your COVID vaccination or your COVID test. So having that one-stop shop for the credentialing management really matters. And then, of course, we also have in that system access to human resources templates. It's Kamana. I'm going to share it at the end, Dale. So how do you compete with larger agencies? This is a great question. So doing that really matters, but it shouldn't be your focus because there's plenty of people who work with local agencies. I tell people to not really make that a thing because with the manpower and at the level that your large healthcare staffing agencies are, they're really not competing with us. So it's something that you have to grow into and it takes some time. So I tell people kind of work in your area, your region, and master where you are. So both of these young ladies, Regina, who was one of our first students, and Yolanda, who also participated in our course, kind of touches on their experience about, just kind of being strategic about it. When creating your business, you really want to think through some of the things as far as, hey, where do I see myself in the future? For some people, it's just about financial freedom. And for others, it's about other things. But honestly, it may not be that you want to be a millionaire. But for some people, it can very much be that reality. So what do we have to offer? So we have all those things. We have your step-by-step program. We have your contracts, your templates, your credentialing management, vendor management, one-to-one coaching, hanging out with me, talking with me, coming up with a plan for your business, as well as access to our business preferred partners. So a couple of those things are new things that we added to the course because we felt like there was a need. So we added more of the coaching services, more of the partnerships so that people don't have to spend as much time looking for them. They have access to those people right there. So we're offering this course. It's going to launch on August 16th at $37.50, which is an amazing value based on the fact that the real total value for the course is $8,000, which is about a little bit under half of what that is. So some things that I like to share with people who talk to me about getting started and things of that nature, who want to kind of say, well, how can I be successful? What would make me different is the experiences of other people. So this is Raven, who just completed our course that we had in 2020, where we partnered with Katie Harris of the Nursepreneurs, which is a humongous community. She speaks about her experience where everything was step by step. And before she knew it, she had her entire business established. And that's what we want you guys to offer. So we definitely want you guys to have in place the things that you need in addition to being able to build and grow your agency. But we also want to make sure that you feel comfortable at the end of 6 or 8 or 9 months to take on your agency and keep the ball rolling. So one of the questions I'm always asked, which I think is always nice, is if I had 2 choices or if I had to do it all over again, would I have done it the way that we did it? Of course, generically, the answer is yes. That's how we learned. But realistically, I probably would do it a little bit differently just because we did learn and it helped me be able to create the group. But the other thing was we lost a lot of time. So if I had to do it all over again, I would definitely invest our money into an opportunity where we can connect with an expert, or we can connect with someone where we can ask them questions. We can throw ideas, with them and back and forth, where we're able to really make sure that, hey, this is something that I want to do, or does it sound like a good idea? A lot of the questions that I get asked, or they said this feedback to me from a facility, should I continue? So I would say I would love to connect with an expert. And of course, for our particular journey, we were able to do that after the fact, but that's something that I would encourage anybody to do who's starting early on. And this is another NOSA. She's actually out of Tennessee, and she's one of the NOSAs who has been thriving. And what made her story so great for me, amongst the other stories, was that she really thought it through. We've had so many conversations, me and this particular NOSA. And one of the things that she was looking for that I think many people want is just the ability to have the flexibility to meet the needs of your family and your household as a wife or mother or both. To be able to use your skill set. Like I mentioned before, we already use so many of those skill sets that makes us be great entrepreneurs. We just kind of have to focus in on them or hone in on those skill sets, and really be able to engage in the role and make a difference in the industry. So a big part of what we did, or what we desired to do, was make a difference in the industry. So she's doing really well. She's in Tennessee. I think she has close to 30 employees and 8 contracts. And she launched in November of last year. So what is it worth? So we always want to know, hey, is it really worth the investment? Should I do it? I don't know. And what I tell people is, starting from scratch in this industry with so much access to so much information without any assistance is not worth it. It's always worth making the investment. And a lot of it is, what type of investment do you want to make? You're either going to spend the money one way or another. And like I mentioned with us, we spent some of our money the other way. So being able to know, hey, I have a coach or somebody that I can call and connect with that can kind of fill in the gaps, or even kind of boost me up to kind of say, hey, yeah, you're on the right track, keep it up, is so key and important for your ultimate success. Because just like you guys who are here listening to this webinar with me, who have accountability partners, you might have coaches or mentors or people in your circle. I too have that. I have a coach. I have an accountability partner. Otherwise, I wouldn't be able to do the things that I do. So again, I'm going to drop the link in there. So for $37.50, we're offering all of these amazing things in addition to the coaching, which is what a lot of people want and value. If you're interested in getting started, as well as if you're interested in getting some more information, feel free to reach out to me directly. But if you're interested, which I would be, in purchasing the course today, definitely get onto it. Okay. Carla, I'm going to come back to that chat question and look into it. So we're offering this particular price at the $37.50 for the next 36 hours. So I understand sometimes you got to think about it. Sometimes you need time. But understand, time doesn't wait for anybody. Who knew we'd wake up one day and it'd be COVID? So definitely, think through it and consider it, and make sure that you're connected with the right community that'll let you thrive and do well in the future in any business endeavors that you're doing. And then finally, a few other things. The VIP coaching call with me, which I typically charge $1,500, is included here. And one of the things that I want to point out that's really important, or a value here with the coaching call, is that I'm going to set your business up for you in the initial stages. So that looks like you get Shamika as your accountability partner for a month or a couple of weeks. So we're going to talk through what you want to do with your business. We're going to talk to action items that you need to complete to kind of get you to the next step or closer to opening up. We're going to sit down and kind of create a timeline so that you're not kind of saying, hey, I feel stuck, or, which I've also heard a lot of, I don't feel ready to launch yet. So we're going to hit those launch goals and those launch dates along with you working through the program. Again, I'll leave the link here. And in closing, I would have never imagined in my own journey in being a NOSA or even creating the group that I would be here having a conversation with people about starting their journey or starting their process. So I am super excited to kind of look back and see what that process was for me a year ago and what it looked like. Okay. And I'm excited to say that I've made the impact and the differences so that not only just myself is able to win, I'm all about the team winning. So you can run a successful agency, you can run a profitable staffing agency. Yes. And you just may need some support. So here's a little bit of information about the 2020 course graduates who graduated with the first course that we ran, about kind of how they are and where they are in the process. And then here's another thing about the preferred partner. So we're doing something different in the second round of the course, is that we're working with the people you guys need to talk to. We're working with the people that'll get you insurance, funding, credentialing, compliance, background, drug screening, scheduling, virtual assistants. We're creating the ultimate package. So that's primarily why it's called the Ultimate Staffing Agency. So finally, let's get to questions. All right, so I'm gonna drop the links here for you guys, and then I'm gonna let you guys ask me your questions. So if you have any questions, you can drop them in the chat, or so this is the link to the course. Okay. Let's see. And then for those of you guys too who, and you can take yourself off mute if you have a question. And for those of you guys who aren't in the Facebook group, I'm also going to drop the link for the Facebook group as well. Okay. Okay. Okay, so let me start up a little bit. I think okay. Okay, so Carla's saying I started with the, I spent so much money at the very beginning trying to launch, but have run into trouble getting there. Is there a payment plan? So there is a payment plan available. If you're interested in doing a payment plan, let me know. Gary saying she paid a lady $2,500 and didn't get much. Are we covering the travel industry? Yes. So the payment plan, please go ahead and email me if you want to do the payment plan. And we cover the industry. So one of the things that a lot of people don't realize is most of your travel contracts are in vendor management systems. Because most of your travelers are looking to go to large hospital and healthcare systems. So that's where you'll see a lot of your travelers at. So if you're not connected to a healthcare system or a vendor management system, you won't really see as many travel opportunities. So yes, we'll definitely talk about travelers. We'll talk about travelers per diem, how to set up your portfolio so that it makes sense. Some people want to do CNA, some people want to do LPNs, some people may want to do RNs or ICU or med surg. So we'll definitely talk through all of that as well. So if you have any questions, guys, feel free to take yourself off mute or drop your question in the chat box. And we're doing amazing on time, guys. I was surprised we hit it. And again, thank you guys for hanging out. Okay, so I launched my agency. Erica's saying I launched my agency, but it's all over the place. I have contracts, but not enough staff. It's taking so long to get workers' comp insurance since no one knows us. What is a VMS system? What VMS system uses new agencies? So Erica, but it's all over the place. I have contracts, but not enough staff. That's contracts with not where are you located, Erica? And I really, if you're interested in doing something different, because this is kind of based in the course, we also will be offering on the 16th coaching. If you're interested in those types of things, go ahead and drop coaching in the group chat so that you can get information about the session that I do that talks about the coaching. So I don't want to, because we're recording it, I don't want to spend a lot of time talking about individual situations so that we're able to really connect people to the right place. It's taking so long to obtain workers' comp since no one knows us. Yes, Carla. I would say Natalie with Encirca is a great resource. What VMS uses, new agencies, career staff uses new agency, Great Tree. Both of those are vendor management system. What's your email? I'm interested in the payment plan. So my email is here. So everyone, my email is info@thenosagroup.com. So I'm going to put it in here again. As well, you guys can also message me in through the link that you used to register for the webinar, so you can message me there. Okay. Shalonda, you're interested in coaching in a class. Okay, perfect. Do I offer classes for already established staffing agencies that are looking to grow? If so, does that entail? Caroline, that might be a better fit for a coaching. So I do offer coaching, yes. What's your email? I dropped it again. info@thenosagroup.com. Do you have any suggestions on attracting staff, and do you suggest COBRA rates for marketing? Alicia, yes. Any suggestions? I would just say figure out what they want. Do a survey. A survey is always good to do. Right. So just in general, Carla, about the insurance, that's the average, and that's been the average since last year. So no one's insurance, workers, specifically your workers' comp insurance, is turned around any quicker than 4 weeks. So it really depends on your state. In Delaware, it took us 4 weeks. We'll be added a new policy out there. It's taken up to 6 weeks in California. It's just because COVID is what it is. I'll send you an email, Del. COVID's creating a higher risk, so people are using the insurance more. Gotcha. Okay. Okay. Anybody else? Again, if you're interested in coaching, we're going to do another session that talks about coaching. Well, go ahead and drop coaching in the chat box so that I can add you to the email. Otherwise, if you're interested in the actual course, I dropped the link, as well as I'll email everybody again with the course information. Anybody that started and you haven't been successful at getting contracts or getting people, coaching is probably a better option. While you're waiting to be licensed. Some steps you can do, Sienna, is research. So you can do your niche, you can do your setting up your websites and your social media if you already have your name. If you're waiting to be licensed, you should still already have your name. So you can do some of that preliminary marketing stuff. Yes, Natalie, most yes. Carla, if you want to message Dale her information, that'd be great. Otherwise, Dale, I'll get it to you. Perfect. So next week we'll have a session on talking about the coaching and give you guys the opportunity to sign up for that. It'll follow a similar pattern as the course, except for it'll be specific to what your agency is going through. But we'll also offer partners. So you'll have access to the partners is essentially what it'll be. So all the partners on there will be easily accessible to you guys. Okay, great. So any other questions? I know we got a couple of people. If you want to say your question, you can take yourself off mute. I placed everybody on mute so that we could ask the question. Yes. Natalie, CTK North America. I tried to email you and your email bounced back. info@thenosagroup. That's it. Or info@thenosagroup.com. That's my email. And then you can also, Winter, that's the email. Oh, it's NOSA Group, my bad. It's not GRP. Any other questions, guys? Let me know. Ask your questions. That's what I'm here to do. Sorry about that, Winter. Oh, okay. So Siona's saying if you reach out to Natalie via LinkedIn, she'll answer more quickly. True. And Natalie's a great resource. She gives a lot of great explanation on the industry. And she's done some presentations, but she has some limitations. So, okay. So again, thank you guys so much.
Thank you.
I will post the recording to the group. It's been great.
Thank you. It was very informative.
Helping take things to the next level. Like I said, as always, I'm all about the team winning. So I definitely want you guys to be able to get the things that you need to make that happen for yourselves. Okay.
Perfect.
As I mentioned, if you're interested in coaching, drop it in the chat box so that I can add you to the list. So I hope everybody has a good rest of their week and weekend. And then the links to join the course are in here as well. And you guys be safe out there, okay? As well, if you want to see the video tonight, check it out on YouTube. So it's on YouTube as well.
How do you get it on YouTube, Shamika? You said
Go to the nurse-owned staffing agency. So we're
that's what your name is on YouTube.
Yeah, I'm gonna put it down here for you guys, okay? So we're streaming live on YouTube as well. All right, thanks guys. I hope you guys have
Thank you.
So I dropped the YouTube if you want to take a screenshot of the YouTube. Oh, okay, thanks, Tiona. You're the best. I'm gonna have to put you on the payroll, Tiona.
Thank you.
All right, y'all have a good evening.
Bye.
Bye.
Bye-bye.
Bye.
Bye.